Good morning. This is Steve Stites, Chief Medical Officer for the University of Kansas Health System. We're broadcasting live from the Dolph Simons Family Studio. I said it right today. That's pretty good. Here this morning, I have a few guests. One person who's not a guest is Hawkeye. Dr. Dana Hawkinson, Medical Director of Infection Disease and Control, something like that, Infection Prevention and Control, and someone who's obviously a regular with me and here on our program. Joining us today is Sean Coomer. Sean is the Vice President of Perioperative Services here at KU. He is also an outstanding liver transplant surgeon, and he and his team, if you need to be transplanted, they do an amazing job. The other good thing about having Sean in the program is his forehead is longer than mine and shows up just so well in the program. I feel better about myself. And then Shay Stoops. Shay is one of our outstanding anesthesiologists. Shay's area of expertise actually is cardiac and liver anesthesiology, which does take a pretty specialized area of knowledge. And so we're delighted to have Shay and Sean on the program this morning to talk with us about safety in the operating room, especially in the age of COVID-19. But before we turn that direction, we're going to turn to Doc Hawk and say, what's going on out there? How are we today?
Yeah. Hey, good news, I think. Good news. So in the health system, we have seen our amount of hospitalized patients and critically ill patients continue to go down these past couple weeks. You know, right now we are sitting at 17 patients in the hospital with 9 of those in the ICU. So we've had some discharges. We still have some patients on the ventilator, and they've been on that for a little bit, but hopefully we can get them extubated and eventually get them home. So I think overall, our numbers are doing good. You know, we have a lot of news coming out with the reopenings and therapeutics and stuff like that, and maybe we'll get to that in a little bit.
So is it fair to say we've bent the heck out of that curve?
I think right now, based on our small numbers in our hospital, but also throughout the city of hospitalized patients, I think that would probably be a reasonable thing to say because of our early stay-at-home orders and everybody being vigilant and doing the right thing.
You know, it is impressive. We've done a lot of government actions about sheltering in place, et cetera, but the real action has been done by you. This has been an example of what happens when people do the next right thing and act responsibly. We're going to come back to that theme at the end of this broadcast, but I really wanted to just say thank you from all of our healthcare workers here at the University of Kansas, from all the people that are on the front lines. We can't thank you enough for what you've done out in the community by sheltering in place, keeping your distance, washing your hands, coughing to your elbow, don't go outside when you're sick, don't touch your face. All those things we talk about every day, that is personal responsibility, and that's why today we have 17 patients. That is remarkable. That's great news, which is why we think it's really important that people still get their baseline health care. Folks I know are afraid that hospitals are houses of COVID, and that if you walk into the hospital, it's going to attack you. We've said before, coronavirus is not a superhero. It does not have wings. It doesn't jump tall buildings in a single bound. And it can be beat by washing your hands, which is not true about Superman. You can't beat Superman by washing your hands. So, Sean, what are we doing to make sure that coronavirus stays in its place when people come in and get care?
Yeah, I think those are important points that you made, Steve, is that we thank all of you what you've done and enabled us to bend the curve in our community. Over the past month or so, we've canceled or postponed over 3,000 cases.
That's a lot.
And that's obviously it's delaying care for our patients. That's not what we want, and we want to get back to that. So to that end, we have started to do some procedures. Just started here in the past couple of days. We've always been doing urgent and emergent procedures, but we're starting to do regional blocks, regional anesthesia, and we're starting to have conversations about what's the next step. How do we tackle that 3,000 backlog, plus all the cases that are coming in now? So we're starting to have those conversations as a group of how we're going to open up the ORs. And I think the most important point is that it is safe to be here. Over the past month here, it's enabled us to get control of what we're doing. And here in the hospital, we've had social distancing, we've gotten all of our temperature checks, we limit visitors. It is safe to be in this hospital. It's safe to be in any hospital. Lots of things have happened where it's safer to be here than probably in your local grocery store. Mostly because the diligence that we've had about being careful and making sure our patients are safe and our employees are safe. So again, I think this is the time that we've got to start tackling healthcare and getting back to what we do best.
And I think it's important to note that there's an increased risk of death at home from strokes and heart attacks, which means that people, I think, are afraid to come back. And what we don't want you to do is let fear hurt you more than COVID.
Right.
You know, we're being so afraid of COVID, and we have this whole news and everything built around it. But at the end of the day, if we let fear control our lives, then we start running into problems that are every bit as deadly as COVID itself. Shay, you've been involved in a lot of the planning here, including trying to turn anesthesia machines into ventilators if we'd experienced that surge of 6,000 patients, which fortunately Kansas City didn't do, at least not yet, and we hope we don't. But talk to us a little bit about some of the preparation that you and your team have been helping work on for the operating room to keep folks safe.
Well, to start this past month, we've changed a lot of our workflow here, both to keep our employees and our patients safe. A lot have to do with social distancing, as we've talked about a lot. Also, in the operating rooms, we've taken a lot of safety measures to protect our patients, but also to protect all our nurses, techs, doctors, everybody that's involved. So for example, some of you may know we've limited the amount of visitors that come with you. So for example, when you're having surgery, we allow one person to come with you. And then once you go back to the pre-op area rather, your visitor will stay out in our waiting area where we have all appropriate social distancing precautions in effect. We will prepare you for surgery, and everybody is wearing masks, as you know. Once we go back to the operating room, we've changed our flow in that the air that circulates in our operating room turns over more than in other places. And I know that a lot of people out there have heard, for example, when intubating patients, that can be a lot of exposure. So we limit the amount of people that are in there, and we talk to our patients before we go back there because we're going to be wearing protective equipment both for us, but for the patients. And then once we get you off to sleep, we allow the air circulation to clean all the air to make it safe for everybody that's in there.
A lot of effort that's gone on to re-engineering how we do things to make sure that folks stay safe. And we do that to keep you safe, and we're going to keep doing that because COVID is still out there. But Dana, big news yesterday on the COVID front, remdesivir. I know there's going to be questions about it. Let's just answer it right now.
Yeah. So Dr. Fauci explained about remdesivir. There are preliminary studies or preliminary results from a large random control study that show that it is maybe favorable for improving your time to recovery. So 15 days versus 11 days. So that is good. That is similar to what Tamiflu does. It improves your time to recovery of symptoms by 1 or 2 days. But this, again, should be noted, and there was an interview with one of the principal investigators last night, and he said this is not a game changer. This doesn't mean that it's cured. This study that was for remdesivir was looking at moderate to severe illness, so people that were very sick and in the hospital. But what it did was have a more favorable chance of recovery and a recovery time that is less than if you didn't get it. So again, that was one of the principal investigators of the study, and it was a large study, and that certainly is favorable. But we still have to understand, as you said, Steve, this is still with us, and this is going to be with us. This is not an end-all, be-all panacea of a treatment for this infection, but certainly the results are favorable.
Tamiflu or Tamiflu? That's a critical question. Which way do you actually say it? You said Tamiflu.
I know. I think whatever you want to put the emphasis on is probably better.
You know,
sometimes you feel a little frisky and you might put it somewhere. But so either way,
Missouri,
oseltamivir. Okay. You can use the long one, the generic name.
I'm concerned by you medicine guys.
But again, I think it's important to note that even with this study, yes, there are favorable results. There was another study published in The Lancet from China that looked at remdesivir as well. It did, again, show maybe some improved time to recovery, but I don't know that the results were exactly the same as this NIH study. So we still need to wait for the final report. Certainly Dr. Fauci feels it's favorable. We hope we can do that. The other thing that we're also looking at, again, is the convalescent sera or the antibodies. So if you've had the disease and you are recovering, we want to make sure that here locally you can help. You can help patients here. You can contact the community blood center, and if you have any questions, you can donate plasma there for that as well.
Yeah, both of those are really big deals. And remdesivir, the randomized controlled study hasn't had all the data fully reviewed yet. It hasn't been published, but we're hearing people talk about it. It does look favorable.
Yeah, absolutely.
And we like that. And the data that came out of the University of Chicago a couple of weeks ago also looked similarly favorable. So we're hopeful that holds. And yes, we are goofy, geeky medicine doctors, these surgical people.
That's all right. I rely on you guys a bunch.
All right, questions out there, folks. What do you got?
Hi, this is Melissa with Channel 41. Quick question. As we start opening back up, one of our reporters had a question about when gyms open back up, should you work out wearing a mask, or is that prohibitive?
That's a great question. Should you work out wearing a mask, Dana?
That's a very good question. I would find it very hard to be working out with a mask.
And do you actually work out?
When I'm not here, I try to. I've been doing a lot of walking. I think certainly if you're on the treadmill or the elliptical, wearing a mask is going to be extremely difficult. If you're just doing weights, I think that it might be reasonable. But again, we need to make sure we adhere to the other guidance that we're talking about. Don't go to the gym if you're sick. Continually, wash your hands or do alcohol sanitizer to your hands. Don't touch your face at the gym because people are touching these high-touch surfaces. So it's a very difficult question. Again, I think if you're on a treadmill or an elliptical, it's going to be hard to wear a mask.
Isn't the real answer to maintain distance? I mean, and how much distance do you need if you're exercising?
Right.
Because I think it may have changed than just from normal conversational speech. I mean, from right here, I'm probably not going to try and spit on either Dana or Sean.
Right.
But if I'm in the gym and I'm breathing harder, do I have to worry about that distance a little more?
If you're breathing harder, maybe just a little bit, yeah. But again, I think we need to continue to do the physical distancing, and that will help.
I think that's more.
Quite a
we're talking
bit.
about the masks, but the reality is the thing that's going to be really important in the gym is to maintain your distance from other people.
Right.
If you do that, the mask becomes much less important. I was talking with the minister at my church last night, Community Christian Church, and we were thinking, how can we have a church service, and how far do you have to stay apart, and how far does a choir have to stay apart? And I think those are really important considerations as people go back. And I think there are ways to do that. There are ways for people to go back into society safely. It is all about personal responsibility. We have bent the curve. Don't bend it back.
Yeah.
And I think that's got to be our thinking. Don't bend it back.
And I think to your point too, whether it's the gym or church, there's other things you can do to mitigate if you have the space. Can you do some of these activities outside? That's important as well. That will help with space and not be in a confined area. So there are different things you can do to mitigate that, and I know that the Archbishop and the bishops are working on restarting Mass and doing church services, and I'm sure there's other congregations working on getting church services back, but in a safe way, because we know that those areas can spread infection quite easily.
All right, next question.
This is Steve Baccarat with
Good morning.
City Star. I was wondering if you guys had a sense of whether they're, given that some of these stay-at-home orders and similar restrictions are being relaxed as soon as May 4th in some areas of the metro area, are you comfortable that there's enough data from a medical perspective to begin making that decision to relax some of these restrictions?
That is a great question, and I'm going to partly answer it, and I'm going to partly duck it. We want to stay in our lane around healthcare. I don't pretend to have all the data in front of me about the economic hardship and things. I've told stories before. My view of it is the cleaners I've been going to for years and the restaurants I go to for years have closed permanently. And I know a lot of folks who are suffering, but I'm not the mayor or the governor, and I don't have all that information in front of me. What I think we can say, and I think we can say fairly, and I want Dana and Sean and Shay to comment on this after. At our peak, we had about 40 patients in our hospital alone We may have had a few more than that with COVID. And this morning we have 17. Why did it go down? Because coronavirus is still out there, and you can see it. It's still out, and there's more nursing home outbreaks, and there's outbreaks out in western Kansas, especially in meatpacking plants. What does that tell you? It tells you the same message we've been saying all along, that if you are around a lot of people and you can't maintain your distance, then you're going to put yourself and others at risk. But here in Kansas City, by sheltering in place, we have done a remarkable job. At some point, we have to reopen society. We can't all stay sheltered forever. One of the advantages we have over New York or other crowded metropolitan areas, more crowded, is that our population density is so much less. We're at 1,400 per square mile. New York's around 30,000 per square mile. We don't have the crowded subways. We don't have a lot of crowded buildings and streets. And there are a lot of great things about New York City, and I love New York City. But that density makes a difference. So how much more do we need to see coronavirus fall from a healthcare perspective before we say we can reopen? I think we have seen it fall far more than any of us expected it to do. So from a public health standpoint, I don't know all the equation because I don't see all of the terms. I don't see all the calculus that's out there. But I can tell you we are really pleased with how well the healthcare community has both responded with frontline workers, but really with how well the community in general has responded, because we just don't have the surge. We're not New York. And 17 patients, that's not bad. I mean, that's like, whoa, much lower than we thought we would be right now. So I think the key will be whenever you open, you have to be personally responsible. You have to do the next right thing. Because once you reopen, that baseline amount of coronavirus will probably go up because people will be in contact with each other a little bit more. And how do you try to avert a major disaster? You do it by just being personally responsible and by doing the next right thing. So from our perspective, I don't know that it's bad to reopen. I think that it still calls on every person to try and be responsible and to do the right thing. And I think that's really the key.
Yeah.
Dana?
Absolutely. To echo your points, I agree with you 100%. It is a new normal. We don't have a lot of information about SARS-CoV-2. We do know about other common coronaviruses, the other 4 common coronavirus which cause mild cough and cold symptoms. We do know that those circulate in the community. We know you can be reinfected with them 4 or 8 weeks later and maybe have mild or no illness. We know that you can be reinfected with it 9 months later and have mild or no influence, no symptoms or illness. But we know, and I don't mean to be a Debbie Downer or anything like that or a Chicken Little, but we just have to act like this is going to be here. And we understand that, but there are things we can do to mitigate that and get back to a normal semblance of life, just as we do, again, it's with the other common coronaviruses. We don't know how this is going to act, but we kind of have to act as if this is going to be here. Maybe there'll be a second wave. Maybe it will just be some sort of baseline activity within the community, but we have to act like that, and we have to make sure that everybody is being personally responsible to help reduce the spread.
And Sean, one of the reasons we wanted to open back the operating room is that we did feel like our numbers of COVID patients were so much lower, we could go ahead and start taking care of patients.
Absolutely. I think it is safe. I think that, I view reopening the operating rooms just like how we're reopening society, is that it's personal responsibility. It's a phased opening. It's not a party. We're not opening back to where we were pre-COVID. We're going back to a new responsible way of opening, and we can't act the same way. And just like we aren't in the hospitals, and we're being very responsible and social distancing and some of the particular things that Dr. Stoops was talking about, our air changes in the rooms and the different processes that we're doing to keep our people safe as well as our patients. That's what we have to do in society as well. It's extremely important that we not all of a sudden go out and have, get together with all our friends and have huge parties. I think we have to be responsible at the grocery store. We have to be responsible at the gas station. Everywhere we go, we have to have this in the back of our mind, because as Dr. Hawkins said, this is going to be with us for a long time. And we're going to have to continually have this in the back of our mind. It's a new way of living and a new way of going through life. And this is what we're doing here in the hospital, and I expect we should do that in society as well.
Shay, are we going to go back to doing things the old way or stay with the new way in the operating rooms with all that work you described just a little bit ago?
Fortunately, since we were able to flatten our curve, we've had the luxury of time to change a lot of our processes. We've had collaborative efforts with internal medicine, with our Palm Critical Care, and so we were able to change a lot of our processes to make it safe, both for the patients to be here, but also for our staff. And I echo everything that you guys have said. This is going to be around for a while. And so we also now have in place ways to handle COVID if we were to see another peak, but it's our responsibility for everybody to maintain their social distancing so we don't see that.
Next question.
Hi, this is Taylor, Channel 41. Good morning. I've got kind of a specific question. I apologize for that, but it's for a specific story I'm working on today with a case that I haven't heard of anything like this before, and I think it's kind of interesting. I'm talking to someone today who has tested positive now 3 consecutive times. After her first initial test, she went under 2 weeks quarantine, tested again, it was still positive, tested again, it's still positive. She's a healthcare worker. And is unable to go back to work for obvious reasons, because she's still testing positive and she's working from home. Her symptoms have been mild, she told me. But I'm curious a little bit about what that, one, how common or how odd that is to you, and 2, what that can tell us about the importance of retesting moving forward, how, because she's having to retest because she's a healthcare worker so she can go back to work. Those of us who maybe aren't healthcare workers, what the plans are in place and what should be in place if we test positive the first time and continue to test positive, what that should look like, and just what it is about the nature of the virus that you're still able to continue to test positive for that long with what she describes as to be pretty mild symptoms. Thank you.
You get the mark for the hardest question in the morning right there, Dana. So I could dump it. No, actually, yeah. I think the answer to this is there's so much about this we don't know. You and I see a lot of immunocompromised patients, and I have a lot of people, you've heard me say, with CF and lung transplants, and we know that they can be positive for a very long time because their immune responses are different. And some people with other common infections like C. diff don't produce antibodies, so they can maintain C. diff, and they have to have specialized different ways of looking at it. Do you think that whole thing, is that kind of what we're going to see with SARS-CoV-2 as well?
Yeah, I mean, that's an excellent question. The data there's not much data about this, but we do know, and for things even like influenza, like you talked about, especially those that are immune compromised, we know that you can detect it up to 3 or 4 weeks after you've had the infection. There is a paucity of data for SARS-CoV-2. There's not a lot of information, but what we do know is that you can detect it up to 6 weeks on nasopharyngeal swabs after you've had the infection. So what does the detection mean? I assume what you're talking about, Taylor, is the PCR test, and that is the most common test that we're using. So it's really not a surprise. We've had plenty of journal articles and references that show that you can detect it up to 6 weeks after you have the infection. But the question is, even though I'm detecting it on PCR, am I just detecting the genome, the RNA, or am I actually detecting an infectious virus? There are 2 studies, one out of Germany, that showed that in the upper respiratory tract, so that would be where you're taking the sample from, they weren't able to culture any live virus or infectious virus after about 8 to 10 days after somebody had symptoms. So even though they could detect it out to 4 and 5 weeks, they weren't actually able to culture infectious virus. There's a new study out of New England Journal of Medicine that had only 2 or 3 patients that they looked at for this, but they weren't actually able to culture any virus from one of their patients after 9 days. So the fact that
live virus.
This was the live virus that they were trying to culture. This was in a skilled nursing facility is where the publication the patients were based out of. And again, it was a very small number, but those are 2 studies now that show between 8 to 10 days, it doesn't seem as if you can really culture any live virus from the upper respiratory tract.
And just to say, the important part of that is if it's not live and it doesn't reproduce, it's not going to cause infection.
Correct.
If it's just the little pieces of the viral particle, which the PCR does detect, then that doesn't cause infection.
Absolutely right.
It just causes you to stay home and not go to work, which
Yep.
is what, I mean, that's appropriate, especially in a healthcare environment, I think, but that's really what's going on.
And that's why also the CDC, has given guidance on, do you do a test-based strategy to get people back to work or into certain situations, or do you do a symptom-based strategy? And the test-based strategy, it sounds like this is what this person is doing, having to get tested all the time. The other option is if they're fever-free, if their symptoms are overall improving, and they've been so far out from their original diagnosis, that's the symptom-based strategy.
And
So,
both are considered valid strategies.
Yeah.
Yeah. Okay. Good. Next question.
My follow-up to that is for people that do test positive, not necessarily this person I'm talking to, but if someone does test positive and isn't in a situation where they are required to retest to go back to work, like a healthcare worker, what should I expect to have to do if I test positive and I stay at home for 2 weeks and then it's still testing positive? Like, should I even test again? What's responded, or what is people responsible for doing once they test positive?
Yeah. Okay. I think this is going to be along the same line. Are you going to be, or if you're symptom free or if you're not symptom free?
Yeah, and I think the big thing that we look for in the symptom-based guidance is if you're fever-free for 72 hours without any use of Tylenol or fever reducer. If your overall symptoms are improving from where they were when you first got tested, then you really should be able to go about your daily business. I would certainly encourage you to look at the CDC guidance for that. Call your medical team or talk with your local health department, because some of the local health departments have a little bit different criteria. But that's probably the best thing to do. Again, if your symptoms are overall improved and you have been fever-free, and it's been, say, 14 days from the original diagnosis, then overall you should be okay unless there's a new problem or new issue. And that's why talk with your medical team or really contact your local health department.
Sean, we just moved to start testing people before surgery to have a test to see if they have SARS-CoV-2. Talk to us a little bit about that strategy and how do you think that's protecting patients? And have we found anybody that we were surprised at?
Great question. We did initiate a pre-op testing strategy. So everybody going through some major invasive procedure is in fact going to have a pre-op test, usually 48 hours prior to that. If it comes back positive, we would cancel that case, or postpone the case, I should say. We have yet to find someone positive in the several hundred that we have tested so far. Again, this is a group that is coming in. They have low predictive value of actually having this virus, but we're trying to prevent a situation where somebody comes in and is asymptomatic for COVID, has their procedure, and then develops COVID symptomatology afterwards. And then the problem with that is there's a significant amount of morbidity and mortality associated with that situation. That is not what we want to do. Again, this is part of the strategy that we talked about before, is we're developing these things because we want to be safe for our patients. And it's strictly a patient safety move as opposed to preserving any potential PPE usage at all.
But we should also state that it's validated by published reports. This is medically validated. The most recent New England Journal of Medicine article about the nursing home facility or the skilled nursing facility, they actually found detection of the virus up to 6 days prior to any symptoms. So this is an abundance of caution. This has been validated by published reports, and it's absolutely patient safety.
All right, next question.
Good morning. This is Cindy from KCTV5. I have a question about secondhand smoke. Can the virus be transmitted in secondhand smoke, or how does it live? Is that a good environment for it?
As a pulmonologist, I would say the best answer to that is to not smoke, but you had to know that was coming, right? You had to know that. Dana, secondhand smoke?
I'm going to say no on
I'm going to
that.
say no too. I think the virus, because smoking itself is probably a way to help kill the thing and or to cause some trouble with it. But you know what? Let's go look in that answer. We'll go find it out and see. I think the answer will be no, though, because of there's a lot of difference between smoke and a viral particle and how they move in the air. And so because of that, they have differing weights and they have different electrical charges and they act differently in the atmosphere. So I'm pretty certain that the answer to that is no. Otherwise, it would have been true for any coronavirus or any influenza virus or any other viruses that are going to travel. And we know that that's not the case. So I believe the answer is no, but I'll verify that and we'll be back with you tomorrow about that.
Thank you.
Yeah, vaping would not be any different, and vaping is also terrible for your lungs, just to say, in case you had any doubts about that. Somebody asked the other day, is vaping a therapy for lung disease, for COVID, and the answer is no.
That's the
no, it's
risk,
not.
is the stuff you're inhaling into your lungs.
Yeah. Next question.
Hey, this is Nate. I got a question for you. Somebody submitted one that's in reference to the KCMO 10-10-10 order. So what is the significance of 10 minutes as opposed to 5 minutes or 8 minutes before collecting contact info for tracing? Should a COVID case be reported in that location later?
Dana. I don't know the 10-10-10 rules.
Yeah, so the 10-10-10 rule, as touted by Mayor Lucas yesterday when Kansas City, Missouri reopens, is 10 people or 10% of your capacity, I believe, whichever is greater, and then 10 minutes. And 10 minutes, I can't really explain why. There have been various studies which show what is prolonged contact with somebody who has COVID. It could be based on that. And there have been various numbers for that. Some studies would say 20 minutes, 15 minutes, 30 minutes. Other studies would say prolonged contact is 10 minutes. It was maybe just chosen because of that. I don't know exactly the reason. I think 10 minutes is a good cutoff to use for close contact, especially if you are, whether it's a restaurant and you're sitting near people. I think that's a reasonable thing to do, as opposed to, say, 8 minutes or 12 minutes. It might just be arbitrary, but there are studies out there looking at what is prolonged contact. How do you call prolonged contact? Different health departments call prolonged contact different than other health departments. So I think the 10 minutes is perfectly fine.
Yeah. I would just say, I think also that major urban areas have a little bit of a different challenge than some areas do. Mm-hmm. We know that this disease treats folks of African-American history, or also, I think, economic issues drive a greater concern for how vulnerable people are. And actually next Wednesday, we're going to take on that question a little bit about patient demographics. And so just a heads up, we'll have a couple of guests. Dave Lisbon, who you heard from before, is back on the program, as is Chris Brown, one of our hospitalists. And I think that we need to address that front and center, because it is a real issue for many of our more urban communities, and we do want to talk about that. So I think that some of them are choosing to be more cautious around it. Next question.
Somebody was asking, because we talked about the gyms, will people be able to swim at a public pool this summer?
Oh boy, public pools and swimming. Man, this is really your show today, Dana. I think, everybody's really kind of focused on all this stuff because of reopening. That's probably good. So
I would like to get to a pool, yeah.
I want to get to Kauffman Stadium, Arrowhead Stadium, and as everybody knows, down in the North Fork of the White River at Riverlife Farm, and get my fly rod out. But
yeah.
And I think a lot of those places are going to be safe. It's still the same story. The problem with pools is the same problem as anything else. If it's crowded, then it's not safe. If it's not crowded and you can get in and swim, it's probably real safe. And chlorinated water is probably really, really safe about coronavirus. But I think that the concern is going to be if people are up against each other or close to each other, that's not as safe. And I think the challenge to us is, can we design an environment in which people can be further apart in public pools?
Yeah, that's the crux of the whole matter, is the proximity of everybody to each other, not only adults, but again, when you have children roughhousing in the pool, that's really where it comes in. Can you physically distance? In the pool, it's probably not a problem. If you are, sitting and changing chairs and all that, and everybody's moving around, that could be more of an issue. But I think the crux of the matter is, can you physically distance? Can you do it in a safe manner?
And Sean, you have two boys, right? Or
Yes,
three? I can't
2
remember.
boys.
And what are they got to be? Are they kind of driving you crazy at home a little bit?
The good news is I come to work. Bad news is my wife is dealing with 2 teenage boys. A senior in high school whose senior year has obviously changed quite a bit, a little bit different than he expected. And then a freshman in high school, and they're rambunctious, and a few things have broken around the house. But nonetheless, they're being great. They're really working hard, school, and trying to get out and do some activities to kind of get the ooglies out, if you will,
Those are important to get out.
Yeah,
Those
absolutely.
ooglies. I
So,
like that.
but no, I think they're doing great, and I think that they obviously want to see their friends. I think that this generation is probably better positioned for this than we are. They've been online and talking on phones and interacting through video games way before this started.
Yeah.
So I think they handle it. They don't get enough credit for being as resilient as they are, but the biggest change is for us old guys. So I think that they're doing pretty well, all things considered.
Yeah. To your point, I had one of my friends. She has an 18-year-old sister, and she said they've been training for this their whole lives. The sister will wake up and be on FaceTime with her boyfriend for 7 or 8 hours during the day, and so yes, absolutely.
Training for this their whole lives,
Right.
because for them it's physical distancing, not social distancing. I got that. Okay. One more question.
KCUR is asking about our staff members. Who's being tested? When are they being tested?
Yeah.
How often are they being tested? Can you speak to that?
You bet. So we can speak to that. Our staff are tested every minute when they walk in the day, or every time they walk in the day, because the first thing we do is a temperature screening, and then they have to answer questions about their health. When it comes to actual testing for COVID-19 with the PCR test or the swab, then we test them when it's necessary. Dana, talk to us a little bit about some of our employee program and how we're making sure our employees are safe, which keeps our patients safe.
Yeah. So employees, whenever they have illness or have concerns, we do have a hotline number that they are able to call. They are screened and they are talked through the situation, everything's discussed. And then once that is, if they feel that it's relevant to test you, then they can get tested.
And I think it's also important to note that we've tested a lot of employees just to be out of an abundance of precaution. And if any one employee gets sick, we do contact tracing for that employee to see who else they've been in contact with, and we test those people. So at the end of the day, we do a lot of tests to make sure you stay safe. What we know is that our rate of positive tests in the health system of our employees is markedly less than what it is in the community. Can you speak to that a little?
Yeah, absolutely. We are testing not only the people that are caring for COVID patients, and again, that rate of infection is much lower than in the community, but we're also testing people who you see every day who don't have any patient interaction or have very minimal patient action and aren't directly caring for specific COVID patients. But everybody is able to be, number one, screened when they come to work, or if they have symptoms even outside of work, are able to call our hotline to get tested so that we can evaluate you, keep you out of work so that you're not infecting other workers or other patients, and really just try to keep everybody as safe as possible.
As we end the conclusion, or we reach the conclusion of today's program, I'd like to turn to each of our guests and say, what are your last thoughts that you want to leave us with? Start with Shay.
I just think that everybody should know that it's safe to come in the hospital and have done whatever you need, but keep your social distancing because we don't want to have to push our anesthesia machines back to the ICUs.
Yeah, boy howdy. That's true. Sean?
Yes, I would echo some of those sentiments. We put so many safeguards in to keep our patients safe. That's our number one priority. We've made measured increases in our procedures and surgeries to make sure our people and our patients are safe. We feel we are safe, otherwise we would not be reopening. So we are doing a phased reopening of our ORs, and we hope to get to even more of our patients. Thank you.
Dana?
Yeah. You know, as we get towards reopening, and as we've been now in this for 6 or 8 weeks, you know, people are looking for sources of truth and what is the true information. What can I believe? I saw this on Facebook. I saw that on some other media. I would ask you to please, you know, really, if you're doing just normal media, vet out your sources. You know, certainly the bigger ones are okay. Please go to the CDC website or your state health department website. That is going to give you the best information for staying safe.
You know, we would all love to say, coronavirus, be gone. Wouldn't that be the best if we could just say, coronavirus, be gone? But the reality is we can't. And so we have to do the next right thing. And we just urge to every one of you again, you've bent the curve. Don't bend it back. And the thing that's going to keep you safe is common sense. Your sense of personal responsibility for yourselves, your family, your loved ones, your neighbors, anyone you see on the street. Remind them that coronavirus is still there. And the way we've bent the curve is by doing the right thing. BKC, keep it up. Do the next right thing. We'll see you tomorrow.